A new treatment that can help.
Yeah, and it deals with a catheter. You know, usually when you hear that, you think, uh-oh. It's a different kind, though. Dr. Pete Jensen will tell us a little bit more about it. So tell us what this is and what it does. It's minimally invasive. We like the sound of that.
Very minimally invasive. The procedure can be done under local anesthetic. After a careful ultrasound that diagnoses the source of the venous problem, and sometimes it's varicose veins, sometimes it's symptomatic, heavy, achy, tired legs, fatigued legs, sometimes restless legs, cramping legs at night. But the point of the problem is that there's a trunk that feeds these veins or congests the lower extremity such that the vein needs to either be removed or closed. In the old days it was removed, and now what the procedure does is closes the feeding trunkal vein.
These are some pretty extreme photos, though, here, the before and after. I mean, the before shows a serious problem here. It's a serious problem,
and if you can imagine up in the thigh, the part of the leg you're not showing there is where the feeding vein resides. So the point of the catheter is to close that feeding vein down.
Closing one takes care of all of that?
It's like a trunk of a tree. Those are like the big branches. Here's kind of an illustration of the catheter. Once I have the catheter in the vein, which I can do with local anesthetic, the catheter resides in the vein, and then as I withdraw the catheter, heat is applied through that generator. And the peak temperature of the catheter is 120 degrees.
So it's not, is it cauterizing it, or is it just heating it up so it closes down?
It's heating it up so it closes down. The proteins in the vein wall shrink down from side to side. The point is not to create a clot in the vein so much as to close the vein wall and destroy the inner lumen of the vein such that it scars it shut.
Okay, does this take care of those little teeny squiggly purple looking veins? Are those varicose
the spider
veins? Yeah, the ones
kind of thing.
Or is this something different?
This is like if you want a tree out of your front yard, you get the trunk first. And then the spider veins, which you're referring to, or the varicose veins, which some of your pictures demonstrated, sometimes will be ablated with this, but other times you have to use ancillary, all local anesthetic or no anesthetic techniques to finish off the job, as if the tree company came out and grabbed the branches and took the leaves out.
Well, what causes varicose veins? My mom used to say if you sit and cross your legs a lot, you'll get, is that a myth?
Myth. The source of the veins are valves that quit working. So valves ought to keep the blood flow up toward the heart but not let it fall toward the feet. Once those valves are destroyed or are not able to work, the blood will pool. And so now when it pools, it fills the leg up. If you can imagine, if you're in a line at the airport and there are 5 people in it, it's always straight. If there are 50 people, it always starts doing that. And that's exactly what happens to varicose veins. It's a place to pool the blood from the feeding trunk. So the real issue is to define that anatomy with a careful ultrasound, and then to address that trunk. That's what the catheter does.
Tell us, though, cost, because I think a lot of people will be interested in this, but is it something where cost is going to make a lot of people not candidates for it?
Oh, no. The cost, this is actually dropped the cost dramatically from the insurance company's points of view because it requires a local anesthesia.
So insurance will cover it in most cases?
Insurance covers it in most cases because the costs are so much better from their end.
All right. Well, interesting. Dr.
So how do
Jensen.
people can just do it in your office, or are other doctors doing this as well?
Oh, no, there are other physicians offering this. There are various technologies. What you want is somebody who's, I think, board certified in vein care, not just a board certified doctor in something, but there's a board certification in phlebology. And I think there are a few of us in this state who do that, and I think there are several physicians who can offer these things.
Okay. Dr. Pete Jensen, thanks very much.
Thank you very much.
Time right now.